Hi, I'm Dr. Milescu. I am your AP1 Lab instructor. I've been teaching anatomy and physiology now since 2009. I've been at Daytona State College as an adjunct professor since January of 2016. I've been here 4 years and I truly enjoy teaching. And recently I've been doing YouTube videos for my wellness center, providing good instruction on alignment and specific exercises for people with orthopedic issues, specifically teaching medical yoga and Pilates. So since that summer off of 2019, I've decided now in the fall to start a series teaching Anatomy Lab and providing instruction online as well, so that you can also have this as an adjunct to coming into labs each week and learning the specifics of anatomy. So today we're going to do the first topic in AP1, which is going to be on your handout, the first handout being Language of Anatomy, and then we're going to go over the body cavities. That's why I have this little man over here. And after that, we're going to, besides doing the human torso, we're going to work on understanding the cell structure and looking under the microscope. So that's today's lab session. Quite a lot to do. So without further ado, let's begin. I won't be doing the whole PowerPoint because that's going to be in lab as well, and you can also download it. So I'm just going to give you some instruction. So let's start with positional terms here, language of anatomy. So the first term is sagittal. So if you have this human torso here, sagittal means cutting the body mid-sagittal, or you could cut the body in small pieces parasagittal. All right? So for purposes of anatomy, the cut is typically mid-sagittal, so we can describe things from the medial line mid-sagittal. Okay? So everything closer to this mid-sagittal line is medial. Everything away from the midline is lateral. All right, so that's the sagittal. So for anatomy, we're going to go over mid-sagittal. When someone gets an MRI, we do small specific millimeter cuts, parasagittal cuts to, for example, examine the brain or the cavities inside and check out the organs and organ systems. All right, so moving on from sagittal, we have the next term called frontal. So this is a position called supine with the palms facing forward. So when you're looking at someone from the front, that's frontal, but how do you distinguish front from back? Well, let's turn the human torso model here. If you cut like this, the body in a front section and a back section, that is not medical terminology. So in terms of anatomical terminology and medical terminology, everything in the front is anterior, everything in the back is posterior, and what cuts and this delineates the anterior from the posterior is the frontal plane. Okay? So far we went over mid-sagittal plane, cutting the body in an equal half, left side, right side, mid-sagittal, parasagittal cuts, but for the purposes of anatomy, we're always going to refer to mid-sagittal. Everything that is further out from this midline is called lateral. Everything that's closer to the midline is medial. So therefore, if you look at this human torso model, the eye over here is medial to the ear, right? Because the eye is closest to this midline. All right, the midline plane, mid-sagittal, okay? So if I cut the body in the equal half, this is mid-sagittal, the eye is medial to the ear is lateral to the eye, okay? Now if I look at frontal, this is a frontal cut. Everything in front is anterior. Everything behind this frontal cut is posterior. Now there's another term that is a synonym that is the same as anterior, posterior. And what is that term? Well, the term is basically, you could say ventral is equivalent to anterior. And dorsal, think of the dorsal fin on a dolphin or a shark. Dorsal is posterior, okay? So ventral, dorsal, also known as anterior, posterior. Going back to mid-sagittal, everything close to the mid-sagittal is medial, everything further away from that mid-sagittal is lateral. All right, and then the last terminology to determine a three-dimensional human being is transverse, okay? So we did mid-sagittal, okay? We did frontal, and then we did transverse. Transverse section, straight across, cuts the body into a superior half and an inferior half, okay? So one more thing I want to delineate is that when we talk about frontal, everything here from the neck down is frontal. From the head, we tend to say coronal. Even though it's the same exact plane, we haven't changed planes, but when we describe it at the head, we say coronal. You can think of it as if someone's wearing a crown. It cuts the body in half, a front half and a back half of the cranium. All right? Now, the directional terms are dependent on the body planes. Okay? So what are the three body planes? To review, the first body plane we talked about was mid-sagittal. The second body plane was frontal, cutting the body in an anterior and posterior. And then the third was transverse, superior, and inferior. So everything above that transverse cut is superior, everything below is inferior. Another directional term is towards the tail. So if you look at this human torso model, everything towards the tail, so below the transverse, everything here is caudal. From cauda means in Latin tail, and everything towards the head, cephalad. All right, so that's a directional term. All right, so we talked about superior, inferior, anterior, posterior, cephalad, caudal, ventral, dorsal. Don't forget, please don't forget, anterior, posterior, synonym, equivalent, same terminology. What do we call it in the front? Ventral, dorsal, or anterior, posterior. All right, we talked about the directional term medial and lateral. It is also a very important terminology because everything that we do, every movement that we describe in movement science, or when we dissect, or when we perform surgery, bottom line is we have to describe where we are in terms of space and what we're cutting. So everything midline, we're going to reference it to that mid-sagittal. So everything close to that mid-sagittal is going to be medial, and everything lateral is away from that midline. All right, now the last thing that I want to go over is proximal and distal. The way you could remember this terminology is quite simple. When you go out a far distance, distal is distance. So distance, distal. Proximal is close, distal is far. So if you look at my hand here, my fingers are distal to my elbow. My elbow is distal to my shoulder. My elbow is proximal to my wrist. My wrist is distal to my elbow. Again, my elbow is distal to my shoulder. My shoulder is proximal to my elbow. My shoulder and my elbow is proximal to my fingers. Okay, so it's positional, it's referencing the directions and how far or close when you're describing a limb or perhaps an incision, if you're performing surgery, things like that. All right, the next thing we're going to go over is the body cavities. So the dorsal body cavity, remember we talked about anterior, posterior, or ventral dorsal. Everything dorsal is back here, or posterior. So obviously the cranial cavity holds the brain. The spinal cavity, as you can see here, the spinal cavity holds the spinal cord. All right, now let's talk about the ventral body cavity. The ventral body cavity, if you look at this torso and we remove this, let me show you. Put him temporarily over here. If we remove the torso, here we go. This is the ventral body cavity. What we're going to go over is the thoracic cavity, which includes the lungs, the right lung and the left lung. And within the lung is a specific delineation as well. So one lung is in one pleural cavity, the other lung is in another pleural cavity. All right, so the pleural cavities are basically holding the lungs. If you remove, I'm just going to remove one lung so you can see the heart. If you remove the lung, and this is your pleural cavity, left pleural cavity, in between is the mediastinum. In the middle is mediastinum. So mediastinum is going to include all the structures behind the heart that are quite centered. So if we take the heart out, the mediastinum is pretty much everything else over here. Okay, so that would include the esophagus, the trachea, the aorta, etc. Now, the pericardial cavity holds, guess what? The heart. Nothing special, everything special, because basically without the heart, we don't live. So the pericardial cavity holds the heart, and the pleural cavity holds the lungs. Delineating this whole area, which we called it what? The thoracic cavity, right? The thoracic cavity further subdivides in the pleural cavities, left and right, and the pericardial cavity, and of course the mediastinum. Now, if you go below, we have the abdominopelvic cavity. The delineation that separates out the thoracic from the abdominopelvic is the diaphragm. The diaphragm is this wonderful muscle that as you inhale and expand the lungs, the diaphragm drops to make room for the expanding lungs to take in the oxygen down the partial pressure gradient, which we'll talk about when we get to AP2. All right, so what's in this abdominopelvic cavity? A lot. So we're going to go over that later in another video. But bottom line is the abdominal cavity contains the abdominal contents such as the stomach, the liver, the gallbladder, the pancreas, the spleen, the small intestine, and the large intestines. All right. The pelvis includes your urogenital system. So if you're female, it's going to include your bladder, right? It's going to include the uterus, the uterine tubes, also known as fallopian tubes, and the ovaries. If you are a male, it's going to include the bladder, the prostate glands, the bulbourethral glands, and other glands that are involved in the reproductive system. And so that's what this whole area here contains, a lot of organs and an entire organ system. All right, so basically we just did a review of body planes and body cavities. One more thing I want to go over is the anatomical division. So I'm going to move the mannequin over, and I'm not sure if we're going to be able to see very well the PowerPoint. We're going to give it a whirl. Bottom line is we're going to get to talking about that, but I just want to review what we've gone through so far. So this here is anatomical position, palms facing forward, thumbs are facing out, hands up, soups up. So holding the soup is supinated hands, right? Soups up, supinated hands. Drop the soup, my hands are pronated. If you want anatomical position, legs are spread out a little bit, all right? Shoulder width apart, palms facing forward, thumbs out. So therefore, according to what we just went over, midline is mid-sagittal, so everything closer to the midline is medial, everything away from the midline is lateral. So therefore the thumbs are lateral and the pinkies are medial in reference to that mid-sagittal. All right, so moving on, I'm going to show you the positions as I move the PowerPoint slides. So this is a review showing sagittal, frontal, and transverse, and all the terms we just went over. All right, so this is a female pelvis. You can see here the uterus, the bladder. So what section are we looking at? It is a sagittal section, cutting the body from the midline and viewing it that way. This is a frontal section. So if we cut straight through like this, that is frontal, and you can view the right pleural cavity, the left pleural cavity, and in the middle, you can see the pericardial cavity right here with the heart inside the pericardial cavity. This view is straight up cut like this all the way around. So that's a transverse cut, and we can see the brain deep into that cranium. So that's a transverse cut. This here is a what cut here? This is a sagittal cut. As you can see, this is a male drawing here. This is a transverse cut. And now I will review the remaining portion of your handout, which is basically going over the quadrants. And then after that, we'll start with the organ systems in another video. All right, so bottom line is we divide the abdominopelvic cavity like this, crisscross. All right, so in the center like this, and then transverse like that. So we have an upper right quadrant, an upper left quadrant, a right lower quadrant, and a left lower quadrant. So why is this important? Because people come in through the ER, for example. I'll just give you an example of a patient coming in through the ER with right lower quadrant pain. If it's a female, it could be a number of things. It could be a ruptured ovary. It could be torsion of the ovary. It could be appendicitis. So it could be a number of things that are involved with that right lower quadrant. So this is why we need to know what is located, what organs and organ systems are located, okay, in all these areas, okay? So right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. I'm going to move on to the next slide. We further divide into regions. So this area right here, right below the ribs, this whole area that we call the solar plexus area when we're working out, that upper abdomen. Okay, what's located here, right below the diaphragm, in the center here, we have the epigastric region. So parts of your stomach is located here. So let's take a look. Your liver is located here. The stomach is located here, so that's epigastric. Now, if we move to the umbilical region, so find your belly button, everything around the belly button, place your hand right here, that's the umbilical region. So what is located here? Pretty much your large intestine, small intestine. Behind there you have the pancreas. So it's retroperitoneal, behind the peritoneum, the tissue in the abdomen. So there's quite a few structures, organs in that umbilical region. Now, the next one's a little bit tricky. It's right here, lumbar region. If you take your hands, lower back, place your hands together like this, fingertips touching that lower back, all right? So you feel the lower vertebrae, the lumbar vertebrae. Place your fingertips together, okay? Now turning around, watch this. I bring the fingertips forward, and voila. What is this? This is the lumbar region, okay? So it's still part of the abdomen, but because if you move the hands behind you, this whole region here are the lumbar vertebrae. So by association, In the front anteriorly, this is the lumbar region, okay? Lots of things to worry about here should someone have issues. We can have bowel obstruction here, small intestine, all kinds of things. We have the ascending colon. If I take the small intestines out here, okay, we have the ascending colon, transverse colon, and descending colon. That's the large intestine, okay? So taking everything out, you can see that there's quite a lot of organs in the abdominopelvic region. Check it out. There's your pancreas, okay? Ascending, transverse, and descending colon. All right, so moving on. If I move him away a little bit, oh, dropped the liver. All right, next thing that we're gonna go over, we did the lumbar region, we did umbilical. The next thing is find your belly button, go just below the belly button right here, create a triangle, okay? This right here, I would say, normally, if we're not talking anatomy, this is your pelvic region, okay? And we always like pull our core in, our abdomen and pelvic floor up when we're doing Pilates and yoga, just to stand up straight. But in anatomical terms, everything below that umbilicus, all right in here, is called the hypogastric region. So the hypogastric region is going to contain the urogenital organ system. So the urinary system and the reproductive system internally. All right, so that's everything that you need to know for tonight's lab, other than making the cheek cells, and we're going to probably talk a little bit more about each and every single organ in the organ systems that we're going to review. All right, but for purposes of this particular video, make sure you know A, the body planes, and the directional terms related to the body planes, okay? B, make sure you learn the body cavities. C, make sure you understand the difference between the quadrants and the regions, all right? Can't think of anything else, but make sure you show up to lab because there's a lot to do. All right, see you later this week. Bye.